Hearing loss in elderly is one of the commonest things that we face in today's day and world. You may find that your mother is not able to hear when you call her. Sometimes your mother may be watching TV at a volume which is much louder, but she feels that the volume is normal. You have to tell them to reduce the volume. Now, with elderly people, the main problem is it's very hard to tell them that you are losing hearing because as a normal person, you will have a resistance to it. If I am told today that Deep, you cannot hear, I'll be like, no way I can hear normally, because to me, what I hear is normal. It's normal or not normal depends on comparing it with other people. So when people come to us with someone in their family having a difficulty in hearing, most of the times the person will say, I don't feel I have hearing loss, but my son tells me that I have hearing loss, or my kids tell me that I have hearing loss. And that's usually the thing. So the first step to understand here is, what are the two most common reasons why we see someone having hearing loss? The most common reason for hearing loss in elderly is the deafness or weakness of the nerve. Now, the hearing nerve is basically an electrical wire. It carries the signals. So let's take a step back and first see how the hearing works, and then I'll explain both of them in a better fashion. Let's go now. When sound waves hit the eardrum vibrates much like a drum or a tabla. There are three small bones that are attached to the eardrum, and this vibration sets those bones also into motion. The other end of these three bones goes into a small cavity, called the cochlea. In this cochlea, you have fluid. The vibrations of the bone create waves inside this cavity in the fluid, much like if you throw a stone in a pond. These waves are picked up by the nerve and they're carried through like electrical signals into the brain. And then in the brain, you have 3 or 4 sites of amplification of the signals, and that is when you finally are able to hear what is known as sound. Now that you understand how the sound happens, the two most common problems that happen is that the nerve, which is the wire of carrying electricity, starts getting damaged. Now, what happens to these nerves is that if you think about it, think of a wire, an electrical wire. A thicker wire has more small copper filaments. Exactly the same way, a younger nerve has more nerve filaments. As we get older, slowly, these nerve filament numbers start decreasing because of slow and long-term oxidation stress, which is basically a medical term for saying wear and tear. Now, as the nerve gets weaker, the signals that are the most delicate to carry through are the ones that first get affected. The signals which are harder to carry for the nerve are signals which are at the higher frequency of hearing. And this is the kind of hearing loss we see most frequently in elderly people. The hearing loss in elderly people is something where at the lower volumes, that means I'm speaking like this, at this point they can hear pretty okay, which is why these people feel that their hearing is quite good. But when I speak like this, these are the places where they lose out. So the biggest problems that happen is why they're increasing the volume on the TV is not because they cannot hear. They can hear, but they're missing out in between the words certain syllables. So for example, if I say this is my name, your grandmother or your mother is hearing it di, I, ma, ne, in. So that means it's very hard for them to understand. That's why when you go near them and you shout, they tell you that why are you shouting? Because the problem is not that they can't hear your voice. The problem is they're missing out those specific sounds on the TV, or they're missing out those specific things. The other big problem that happens in these kind of nerve loss issues is when there are a lot of people in an environment. See, if it's a very quiet room and I'm speaking, most elderly people are able to manage it by using a combination of lip reading and kind of filling in the blanks, which your brain is extremely good at. But if there are 5 people and all of us are chatting here, then it becomes very hard for their nerve to be able to carry the information correctly, because the main problem here is that the nerve has 2 functions. One is to carry the relevant information, and 2, to suppress the non-important information. This is very, very critical to understand, and I will tell you why in the next section. So as we get older, the nerve getting weakened is one of the most common problems that happen. In this kind of scenario, elderly people start losing words in crowds when you guys are having a chat, family meeting, etc. And they start feeling isolated. They start not being able to focus, they can't participate in the conversations, and that is the main problem that happens. The second most common reason that we see this is a small hole in the eardrum. Now, these holes in the eardrum may be there for many, many years, and it has never bothered them, so they've kind of learned to live with it. These eardrum holes need to be repaired, because these eardrum holes, as your grandparents or your parents get older, the immunity inside the body decreases, so the chance of sweat, etc., carrying infections into the ear by going through that hole in the eardrum becomes higher. So as they get older, the risk of infection become higher, and since there are many important structures including four nerves, the brain, the main artery, the main vein that carries blood to and from the vein, because of all these structures being there, an infection in this area called a mastoiditis is very, very worrisome. The surgery that is done for repairing these eardrum holes has completely changed. In the past, the doctors used to make a cut behind the eardrum, and we used to have to remove some bone and go and fix it, which was a much bigger deal. But now these surgeries can be done using an endoscope through the inside of the ear canal with no cuts, no pain, and no healing. That's a huge topic, so that part we're not going to be discussing in this video. That will be a separate video which you can see later. Today we're going to mainly focus on the nerve related loss. So now let's go to the next section and understand that how do these nerve losses impact elderly people, what are the long-term issues that they face, and what are the treatment options we have. Till a few years back, the implications of hearing loss in elderly was poorly understood. But as more and more studies have been done, we have started understanding how important hearing is to a person's brain. Much studies, including what you can see on the screen here, has shown that hearing loss actually is a very strong marker for loss of brain volume in elderly patients. That means brain atrophy. It has a very strong connection with dementia, elderly depression, and elderly melancholia. All of this means that hearing sounds and making them make sense inside your brain is the most powerful brain exercise that exists. That means that I'm speaking to you in English. There are sounds that I'm making. It's your brain that is taking these sounds, putting them together, and making you understand what I'm saying. If I speak to in French, parlez-vous, etc. I mean, I don't know French, so I'm not sure if that was French, but whatever. If I speak in French, that means nothing to you, and that doesn't do the same thing, because your brain is not working there. Those are just random sounds which make no information. So understanding sounds in a language that you speak actually helps keep the brain volume intact. There are very strong data that show that uncorrected hearing loss precludes, like it predicts dementia and brain atrophy and depression in elderly as the strongest factor in the next 5 years. What that means is that when your parents or somebody is not able to participate in a conversation with a group, it makes them feel cut off. It makes them feel socially withdrawn. Social withdrawal is one of the strongest factors for elderly depression and melancholia. And this is why we need to treat these hearing losses. These hearing losses are not innocuous. It's not like sab logo ko thoda sa hota hai, aisa nahi hai. If it is increasing, if it is getting worse, and if your parents are having issues, treating it earlier is imperative, because remember, in these kind of nerve losses, we cannot bring back what is lost. We can only prevent what is not lost. In this situation, their prevention is the only option, because we do not have a cure option. So if you feel that someone in your family is suffering from this, get them to the doctor, get the hearing checked, because the earlier it is found out, the earlier the treatment is started, the better the long-term results are. Now we're going to talk about the treatment protocols, okay? So let's talk about it in this section. The treatment for hearing loss in elderly due to nerve loss is two. Number one is using medications, which are basically certain kinds of multivitamins, certain kind of antioxidants. All of these things that are used have shown to have mild improvement in the hearing results, but on a greatly important note, they have not been shown to be harmful. So we do add these medicines for a little bit long term. Mainly these include vitamin B12 replace. We also do some antioxidants like vitamin E, certain other kinds of herbal extracts like ginkgo, etc. They are all considered to have good action in this, but I will be very frank with you, the research data is not of the topmost quality. It is quite mild, but still as doctors we do recommend it, because even if it doesn't help someone massively, it is not going to harm them. That is my first quality. I do not want to start a medicine for an elderly person which can have the slightest risk of harming them. Now we come to the next thing. The next thing is hearing aids. Now many times people think that hearing aids are like sunglasses. You wear it for that particular purpose, but that is not true. There is good studies, as you can see here, that have clearly shown that hearing aid usage versus non-usage clearly shows the diminishing of the cortical nuclei. That means that people who are using the hearing aids to do the job, they show that their subcortical nuclei, that means the brain atrophy, is much extent, it is prevented. Whereas people who don't correct it, their brain atrophy is happening at a much faster rate. And it's very easy to understand why that happens. There are two main reasons why this happens. Number one is the brain part. If I am able to hear the sounds and make sense of it, then my brain is getting stimulated. Obviously, a stimulated brain does not lose its function, whereas a non-stimulated brain loses its function earlier. That's fairly okay to understand, and the studies are bearing that. But the other thing that we're seeing is that in some studies are showing that actually the nerve loss is also decreasing. It's not as bad as a non-corrected person. And the reason, the current understanding on that is that your nerve has to do two things. One is to carry the sound, but two, to dampen the sound which are not relevant to this, okay? Think of it like you have a wire and there is a voltage outburst. If the voltage is high or the voltage goes low, a big wire may be able to bear it, but a small wire will definitely burn through, because that small wire does not have the capacity to carry a higher current than what is normally carried. That is very similar to what is proposed to be happening. That means that when you are crossing the street, a car honks right on your face, a dog barks right next to you. Now, if that happens, what a normal nerve will do is a nerve understands and it immediately desensitizes it so that the sound is dampened before it affects the nerve. But in an elderly person, this reflex takes much longer to be taken care of. So because this pathway is not as good, the noise-related damage is much higher in these cases. So that is where the hearing aid comes in. The hearing aid actually not only increases the sound in the frequencies where it's necessary, but it has something called as a compressor function, which is why a hearing aid is not the same as a Bluetooth earphone, because a hearing aid has a compressor function. This is called a dynamic compressor. What it does is that once the sound goes beyond a certain level, before the sound enters your ear, the hearing aid tries to compress that into a manageable amount. And this is another thing that is very important. So when we look at elderly patients, if their hearing loss is moderate to severe, we talk about giving them a full-blown hearing aid, which is called a BTE hearing aid, which has a much powerful device. But suppose a parent comes into us and their hearing loss is not very high. We talk about something called as an RIC hearing aid. An RIC hearing aid is sort of like a little brother of the big guy. This doesn't need to be worn 8 hours, 10 hours, 12 hours a day. You just need to wear it when you need it. And we find that for elderly people, because this looks fairly small and innocuous, it is a much easier starting device for them than to get used to a big, bulky behind the ear hearing aid, which makes them feel, which is a constant reminder that, oh, I cannot hear. Whereas the RIC is a much smaller device and people usually like it. Now, the other thing that we tell patients is that make sure to use it when you need it. That means when you're going out for a walk, you're crossing the street, you're out with your friends, wear it. And we find that once people try these RIC aids, most of the times they love it. And this does the main function that as a doctor I'm looking for, is to prevent the nerve from getting damaged and to continuously stimulate the brain so that over a period of time, the brain atrophy is slowed down and prevented to a large extent. Along with this, we do start most of them on some supplements. We do get their blood work done. And many of these elderly people will have other deficiencies in micronutrients, sometimes zinc, sometimes magnesium. Many times they will have frequently losses of calcium. So if these ionic deficiencies are there, we usually try to replace them. Most importantly, one thing that we always tell the families of the patients is never ever force an elderly person to go for a hearing aid. Be calm, let them try the hearing aid. And usually the more you force a person into something, the more it makes them resistant. So if you feel that this is something that your parents are dealing with, now you have the information, do your own research, go into the doctor, speak to them, ask them if a RIC option is good for your family member, whoever it may be. And if it is, just let them try it. If they love it, it can massively help in their long-term hearing outcomes. Any questions, please feel free to reach out to us. This brings us to the close of today's topic. I'm Dr. Diptarka Bhattacharyya. We're Dr. Bhattacharyya ENT. We're always here to help you and assist you with any ENT doubts that you maybe have. And if you are in Bangalore, please feel free to walk in. We'd love to see you. We'd love to take care of anything that you have going on. Namaskar. Have a good day.